high blood pressure increases the risk of stroke, heart disease, kidney disease, and other health problems. Too much sodium worsens it, and most Americans consume more than recommended. The American Heart Association suggests limiting sodium to 1,500 milligrams a day, especially for those with high blood pressure. Let's add pregnancy into the mix. How do these factors put women and their fetuses at risk both during pregnancy and afterward?
So having high blood pressure of pregnancy, which there are several different conditions that this is termed. So preeclampsia is a very famous condition that is a hypertensive pregnancy. You can also be diagnosed with chronic hypertension of pregnancy, which is a woman who has high blood pressure prior to pregnancy that keeps on during the pregnancy. Gestational hypertension, which is a new onset or pregnancy-induced high blood pressure, and superimposed preeclampsia, where a patient has high blood pressure prior to the pregnancy and then goes on to develop preeclampsia. So I use preeclampsia, and that's kind of a big word. Preeclampsia means a high blood pressure of pregnancy that is also accompanied by a list of symptoms that can include headaches, seizures, peripheral edema, which means swelling of the hands and feet, vision disturbances, as well as some other elevations in liver enzymes and other things that can happen in pregnancy. These women are at very, very high risk for having an early term delivery, for having a hemorrhage, and for having a small for gestational age baby, which means a baby that is very low on the growth curve. This leads to an increased risk for them to have hypertension later on in life and other adverse outcomes, including stays in a neonatal intensive care unit. So it's very important for us to monitor these patients that are developing hypertension in pregnancy or that have hypertension prior to pregnancy to make sure that we can manage their risk for these adverse outcomes. Pregnant women need to make sure that they are going to their prenatal visits, that you are getting your blood pressure checked regularly, and that you check your blood pressure regularly after your pregnancy, because pregnancy can lead to postpartum high blood pressure increases that are equally detrimental to those that are found in pregnancy. So it's very important for women to take control of your health care, make sure that you are being heard, and make sure that you are aware that if you have high blood pressure, you can make interventions to try to fix it. You don't have to live with it.
This has been very enlightening. Dr. Faulkner, thank you so much for talking with us about high blood pressure in women, and thank you for being with us on House Calls.
Thank you so much for having me. I enjoyed the visit.